A ransomware crew says it stole a dental practice's entire patient file, x-rays, consent forms, health records, all unencrypted. The name posted to the leaked site, Fairview Dental Group. It happened on August 21st, 2026. And by the next day, no office using that name had said a word. This is the file on a breach that might be real, attached to a name that might belong to nobody. Rhysida posted the listing at 12:28 UTC on August 21st. Leak sites like this exist, so a ransomware crew can pressure a victim before anything leaked for real. The wording here read like a dental office's own website: family dentistry, cosmetic treatments, dental implants, invisible braces. That is not an accident. Leaked pages like this often get written straight from a practice's public marketing, then wrapped around a ransom threat. What did Rhysida claim to have? The full patient database, every x-ray, scanned consent forms and invoices, health records for, in the group's own words, the entire practice. All of it, they said, unencrypted, exposed, not locked behind a passcode. The listing even teased that there was more data still to come. That claim came from the criminals, not from a lab, not from a regulator, not from anyone who could actually verify it. Notice the pattern. The leaked page's business description, family dentistry, implants, invisible braces, matches thousands of small practices across North America. Search that same wording, and you will find nearly identical language on real dental sites nationwide. Generic branding is good marketing. It is terrible incident response. A vague name gives a victim cover. It also gives everyone else confusion. Security researchers know Rhysida well. It runs as a rental operation, ransomware as a service. Criminals lease the software, hit a target, then split whatever the victim pays with whoever built the tool. It is not one lone hacker at a keyboard. It is a business model built for volume, repeated against the next target the moment one deal closes. Government researchers have tracked Rhysida since May 2023, hitting healthcare, education, manufacturing, and government networks. Trade press covering the group's leaked site has counted orthopedic and dental practices among its victims, a pattern, not a one-time story. Dental offices were already on Rhysida's list before Fairview showed up. This would not be Rhysida's first dental victim. In February 2025, the group listed a practice called Leading Edge Specialized Dentistry. Different name, different office, same playbook. Fairview would simply be the newest name on a list that already had teeth in it. Here is the asymmetry. A family dental office holds years of imaging, consent paperwork, and insurance records, a small business's worth of highly sensitive data. But its security budget rarely looks like a hospital's security operations center. Big target value, small defense team. That gap is exactly where ransomware crews go hunting. Dental, orthopedic, any small medical office with more patient history than IT staff. Here is the first turn. Rhysida's own listing does not name a country. No city, no domain. A group that usually tags its victims left this one blank. And that blank space is the whole mystery. Two real businesses share this exact name. One sits in Westmont, Illinois, open since 1988, offering family and cosmetic dentistry, implants, clear braces. The other sits in the Toronto area, offering nearly identical services under the same words. Both public websites still read like normal business as usual, no incident banner in sight. Neither has confirmed anything. Neither has denied anything. Both simply share a name. A third wrinkle. There's also a Fairview Dental Associates in Fairview, Tennessee, a different legal name entirely, registered separately as a general dentistry practice with its own registry filing. Easy to confuse in a panicked search. Almost certainly unrelated. Name collisions like this are exactly how misinformation starts spreading online before the facts do. Why does this matter beyond confusion? Because until a real breach notice, an HHS filing, or a state attorney general letter appears, nobody, not patients, not reporters, not us, can say which office, if any, actually lost data. A generic name doesn't just confuse the public. It slows down the investigators trying to notify the right patients. Zoom out to how Rhysida usually gets in at any target. Government researchers describe a repeatable path, a stolen remote access login, or a phishing email. Then a known unpatched flaw called Zeralagon, if it's sitting open, quiet access inside the network. Then the leak site listing you are watching right now. The listing itself is a pressure tactic. Rhysida runs on double extortion, lock the data, then threaten to publish it unless the victim pays. A countdown clock, a tease of more data still to come. No negotiation happens in public. The leak site is the ransom note now, written for an audience of one nervous business owner. Second turn. One dental office sounds small next to a hospital chain. But a single chart can hold x-rays, insurance numbers, and a child's treatment history, all filed under one ordinary, easily searched name. As of this recording, silence. No breach notice on either candidate practice's website. No posting on the federal HHS breach portal. No state attorney general filing under this name. Bravado from the criminals. Nothing yet from anyone who could confirm it. Everything reported so far comes from threat intelligence monitors, services with names like Hendry Adrian and Hookfish that auto-ingest ransomware leak feeds the moment a name posts. They're excellent for catching the clock the second it starts ticking. They are not proof of what actually happened inside a network, and they never claim to be. If this claim holds up, think about what sits in a dental chart. X-rays, insurance numbers, consent forms with a name, a birth date, sometimes a child's, years of visits, billing, and treatment history tied to one household. Records built for care, not built to survive a leak site. That is the file that might already be sitting on Rhysida's servers. Fairview did not stand alone that day. On the same date, Rhysida also listed Battle Creek Public Schools. This is not a one-target operation. It is a daily feed. Victims added the way a store restocks shelves. Is the data already public or still just for sale? The listing does not say either way. Is it really unencrypted, wide open? Only the criminals claim that. There is no independent forensic report confirming the access path or the scale for this specific listing. Every answer here still starts with according to Rhysida. Third turn. What we still don't know outweighs what we do. Which office? How many patients? Whether appointments are even running. The filings that would answer this haven't been written yet. If you're a patient of any Fairview Dental Group, treat this as watch and wait, not panic. Do not click a text or take a call claiming to be your dentist's office asking to verify a card number or reschedule urgently. Scammers read the same leak feeds we just did. Real notices arrive by mail or a posted statement, not a rushed phone call. For any small practice reading this as a warning, government guidance on Rhysida is blunt. Turn on multi-factor authentication. Patch external-facing remote access before an old flaw gets exploited. Keep offline backups that ransomware can't reach. Segment the network so one stolen login can't reach every chart in the building. None of that is exotic. All of it gets ignored constantly at businesses this size. This file stays open. Fairview Dental Group may be Westmont, Illinois. It may be the Toronto area. It may be some other office entirely, or the claim may fade with no confirmation at all. We built this from Ransomware.liv's listing, Threat Monitors Hendry Adrian and Hookfish, and the CISO advisory on Rhysida. Full links in the description. Which corporate failure should we open the file on next? This was corporate breach.